So we invite people down to our enrollment workshops because, like you mentioned, Duncan, there's a lot of misinformation, a lack of information, and a lot of negative press about the Affordable Care Act, about Cover Oregon, and about healthcare enrollment. So specifically here with SEIU, we're inviting our home care worker members to come down because their plan is being updated and changed to be based on the Affordable Care Act. So our members are enrolling in Cover Oregon and the Affordable Care Act as part of their union contract. So we have them come down, walk them through the process, explain them how Cover Oregon works, and give them an overview of our process here. So basically, Cover Oregon and the Affordable Care Act, the main goals are to provide affordable health care to everyone. So anybody can apply. We welcome anybody to come apply at our workshops here. Most of the people that are here today are our members, our SEIU members that are home care providers, getting their health insurance, but we welcome them to bring their family members, to bring other household members, roommates, anyone that doesn't have health care or wants to find more affordable health care. So by applying through Cover Oregon and the Affordable Care Act, the application helps us to determine whether somebody is eligible for the Oregon Health Plan or for a qualified health plan. A lot of people know now that Oregon Health Plan has been expanded. As of January 1st, it's now OHP Plus, Oregon Health Plan Plus. It's been expanded to cover more providers and also more individuals. In the past, for the past several years, it's been called Healthy Kids. That's what children were getting. Anybody under the age of 19 at a certain income level were able to get Oregon Health Plan Plus or Healthy Kids. My kids have it. It's been great coverage for them. But now that's been expanded to adults of lower incomes as well. So this application actually helps to determine whether someone is eligible for that, which is great because it's free insurance. It's through the state. But the application, if you're not eligible for Oregon Health Plan, then you find out about the qualified health plans. Qualified health plans are the kind of traditional and typical insurance programs that you're familiar with that you can go out and buy on the open exchange, like a provider like Providence or Kaiser Permanente. Basically, the way the health insurance exchange works is it's like a shopping mall. Anybody can go to the mall. Anybody can go into the mall and shop. But based on your income, it determines how many coupons you get, say, for that mall. Because when you apply and you're deemed eligible for a qualified health plan, you're also eligible for federal tax credits. Those tax credits that you're eligible for are applied to your monthly health care premium, your monthly payment, and whatever's left over is your responsibility. So you walk into that shopping mall, someone hands you a stack of coupons based on your income level, and you pick the store that you want to use those coupons at. Whatever's left over after you make your purchase is your responsibility to pay, which is far, far less than it would be without this help from the federal government. So people are, there's been a lot of confusion in the follow-up process from Cover Oregon because it's a new process. Cover Oregon has gotten kind of a bad rap, but this is a huge undertaking. I don't think it would be easy for anybody with the amount of people that have been applying for coverage. So what we're doing here is helping to explain that, helping people to navigate that process. So what we're finding out now is that after people apply and we submit their applications, they get a follow-up letter from Cover Oregon that tells them that their application has been reviewed or submitted. Then they'll get something that says how much federal tax credit they're eligible for. They'll say in the letter, this is what you're eligible for, this is your tax credit. They'll get a plan selection guide and a shopping number. Once you have that, you can go online or request a paper packet to shop for plans, for insurance plans. Here at our workshops, we also have an insurance agency with us to help us because they're insurance professionals. They're certified through Cover Oregon. We're all certified as application assisters, but we're not insurance professionals. So when people have questions regarding specific plans and coverage, we encourage them to talk with the insurance agency that's here with us. They're here at no additional charge to people that come in to apply. So they can help you make an informed decision. So that's something that I think is unique to the workshop, that it's all in one place. But if you do apply, you get that information back from Cover Oregon, you get the shopping guide, then you can apply that tax credit to your monthly premium and find out how much your premium would be every month out of your pocket, right? But that's the only way to find out. That's what we've been trying to reiterate to people. The only way to find out how much it's going to cost or what's available is to apply. If you do nothing, then you have no insurance. You also will get assessed a federal tax penalty, so you're burning money for nothing after March 31st. So we encourage people to come to our events. It's kind of the overview. We set up in stations. We have people out here applying, working on their actual applications. We have the sisters walking around like Katie there. They are answering questions for people on how the application actually works, and specific questions about what to claim, income, household income, things like that. And then we have their applications reviewed in the back corner because we want to make sure that there aren't any mistakes, that they didn't miss anything, so that the application doesn't get delayed in process. After we review it, we determine whether or not they need to speak with an insurance agent. If they're not eligible for Oregon Health Plan, then we have them speak with an insurance agent. Insurance agent gives them plan details and plan options, and then tells them a little bit of follow-up, and then we have them check out before they leave so that we can verify that their application was submitted, that they spoke with an insurance agent, that they don't have any further questions, and we collect their contact information so we can follow up later and make sure that everything got done correctly. And that's really our process. We're trying to keep it really tight and really consistent so that we can answer everybody's questions and we can track everybody.